the official opening of the Africa STEMI Live Conference 2022. This is the third time the conference has been held in Kenya, and we're honored to host this prestigious meeting once again. I thank the organizers of this meeting for your tireless commitment, for your time and resources to present this stimulating environment to collectively address the urgent problem of the rising burden of cardiovascular disease globally. I warmly welcome teams of medical experts and healthcare practitioners visiting from all over the world. Thank you for your participation and for being willing to share groundbreaking lessons and strategies during the Congress. The 5-day program has been designed to achieve one common goal, that is, to further prepare you in finding homegrown solutions to address the growing cases of heart attacks and cardiovascular disease. I'm especially encouraged by the extensive partnerships that have been forged since the initial Africa STEMI Live in 2017, featuring partners from the African continent, Asia, the United Kingdom, China, the Ministry of Health, and members from the Pan-African Society of Cardiology, the Kenya Cardiac Society, Heart Attack Concern, and hospitals in Kenya. Your participation is a demonstration of the priority you give to this innovative and multidisciplinary program, specifically the access to information, diagnosis, and early treatment of the disease. I urge us to work harder to raise awareness and attention to this issue. It will require more research effort, data collection, and knowledge that will help identify the unique symptoms that heart attack patients present with. That way, we will be better prepared to protect their health. Dealing with this urgent issue also requires cultivation of partnerships, resources, human capacity, legislation, and policy interventions. I applaud the advances that have already been made by our government and all the partners represented here in prioritizing cardiovascular disease through preparedness initiatives across the country. Projects we have heard mentioned here include the Kenya Country Preparedness Initiative, the recent National Hospital Insurance Fund amendment that proposes to include cover for acute heart attack treatment, the expansion of diagnostic capability within our county-level hospitals, as well as the training of STEMI champions. These interventions have all contributed towards the impact we jointly seek to strengthen the resilience of our health systems by giving wider access to treatment and by further addressing financial barriers that have hindered many Kenyans seeking treatment. I encourage you to continue the work that you're doing because it will impact millions of people in the world so that global communities may obtain the optimal cardiovascular care they need. We know that health is a precursor to development and growth. It is only healthy people who can be productive and successfully contribute at all levels to spur economic growth. To this end, our joint effort will require a holistic approach that calls on our individual and personal commitment to support our quest to lead healthier lives. It involves healthy living, training, some of which is being offered during this conference, and access to life-saving drugs, especially in those hard-to-reach areas. Clot-breaking drugs ensure that a patient stays alive before they can reach hospital that will place them in a comprehensive intensive care unit. So I once again thank Africa STEMI for this important initiative that has drawn diverse expertise and strong partnerships from both public and private sector. I believe that in this room, we have what it takes to advance our strategy for tackling cardiovascular disease. I wish you all fruitful deliberations. And with those remarks, it's my honor to declare the Africa STEMI Live Congress 2022 officially opened. I thank you.